Welcome to the first week of HSERV 162. This and the next 2 weeks will probably include these types of brief overview of the chapter we're reading in the textbook. And the simple reason is that there's no prerequisite for pharmacology and physiology. Therefore, I need to start at ground zero, and whatever that means. It means the beginning. So for some of you, you may have had this stuff at some point in your academic career. And if so, be patient, because we will move through this and then introduce some very stimulating and challenging topics on drug pharmacology later on in the course. But I have to make a common framework of understanding by building a foundation of the basic pharmacology and psychopharmacology's concepts, so we can understand what's called a drug's mechanism of action. And that's really the overarching goal of this course, is to understand a drug's mechanism of action. So for an example, why is it that, I'm not asking you, these are just rhetorical questions. Why is it that an antidepressant drug can reduce depression? It's just a molecule. Why is it that morphine induces constipation, suppresses pain, and elevates mood? It's just a molecule. And still, how does methamphetamine suppress appetite, inhibit sleep, increase physical energy, and induce euphoria or elevated mood? It's just a molecule. How do these molecules do that? In other words, a mechanism of action is, how does the drug do what it does? And that's really what we're after here. But before we can get to the various drug categories and look at their mechanisms of action, we need to build a foundation of the physiology and pharmacology of substance use. So the first week is how drugs are handled by the body. So this brief overview supplements your reading, is not instead of, and hopefully if I do my job right, it really enhances the concepts that will be introduced to you via the textbook. A couple of important distinctions is pharmacology, which is the science of how drugs affect the body. And then a branch of pharmacology, of which there are many, includes psychopharmacology, which is the focus of HSERV 162, and that's the study of how drugs specifically affect brain and behavior. And then the concept of pharmacokinetics is the process by which a drug gets into, moves through, and is ultimately eliminated by the body. And lastly, pharmacodynamics is the interaction of a drug and the receptors inside the body responsible for the drug's action. So pharmacology, psychopharmacology, pharmacokinetics, and pharmacodynamics. We want to talk about the life cycle of a drug. That's the nature of pharmacokinetics, abbreviated PK. PK helps to determine the time course of a particular drug's action, how long it will stay active in the body. PK also allows for the understanding of a drug's bioavailability, which is the portion of a drug that enters the bloodstream and produces an effect over time. And there are 4 processes that determine a drug's bioavailability, abbreviated ADME. And the A is for the administration and absorption. The administration is the process by which a drug moves from the site of action into the measurement of the bloodstream. In other words, the manner in which the drug is ingested ultimately has to get into the bloodstream. Absorption is the passage of the drug through membranes, capillary walls, and stomach linings if it's taken orally, etc., etc. And it has to reach the blood, where it then is distributed through the body. The D is distribution, and that's the movement of the drug from the blood to and from the tissues and target organs of the body, where something happens. Metabolism is the chemical modification or biotransformation of drugs, with the overall goal of getting rid of the drug. And that's a major function of your liver. Excretion, the E in ADME, is the irreversible removal of the parent drug from the body, and the main process where the body eliminates unwanted substances. The most common route of elimination or excretion is via the renal system through the kidneys. But there are other routes, exhalation from breathing via the lungs, and perspiration through the skin are other ways toxins or elimination processes occur. So in the A of ADME, there's administration and absorption. We're looking at routes of administration, and there are three basic ones. The first route is enteral, and that's by way of the gut. Typically, it's somebody swallowed something, a pill, a liquid, or under the tongue. It absorbs into and out of the stomach and into the bloodstream. The second route is parenteral, outside of the gut. So it's not swallowed or introduced via the gut. It's outside of that. And the most common ones are intravenous route of administration, intramuscular, inhalational, etc. And the third system by which a route of administration introduces a drug to the body is local. With skin topical ointments like Neosporin, or nose drops like Flonase, or eye drops such as Clear Eyes. And after absorption, there's the process of solubility. Solubility is really the ability to be dissolved, especially in water. What has the ability to be dissolved? The drug molecules that were swallowed, injected. Actually, injection doesn't require solubility because it goes right into the bloodstream. But inhalational, topical, transdermal rely on solubility, the drug molecules, to be able to be dissolved. Now, there's two rules of thumb under absorption. Substances are either lipid soluble or water soluble. If they're lipid soluble, it simply means they easily absorb into the bloodstream and across the blood-brain barrier, whereas water-soluble drugs or molecules have a more difficult time absorbing and crossing into the system. After absorption into the body, there's drug distribution, and the liver breaks down substances, and we call that metabolism. So before the blood goes to the rest of the body from the gastrointestinal tract, it passes through the liver. And a certain amount, not all, but a certain amount of the drug is then inactivated as it goes through the liver. The liver is the major organ that breaks down drugs, aka metabolism. And metabolism happens mainly in the liver. Metabolism and elimination. Drug metabolism is the term used to describe biotransformation. That's where the liver biologically transforms or changes the parent drug into another byproduct, another form called a metabolite. But drug metabolism is the biotransformation of substances in the body so that they can be eliminated more easily. And the majority of metabolic processes that involve drugs will occur in the liver. And liver has specialized enzymes. An enzyme is a protein that facilitate the reaction are concentrated there. These liver specialized enzymes are called the P450 enzyme system, of which there are many, and they transform lipid-soluble drugs into more water-soluble form, a metabolite, for elimination and excretion. The liver P450 enzymes biotransform drug molecules from lipid-soluble to more water-soluble so they don't reabsorb very well. Remember, lipid-soluble drugs absorb and will reabsorb over and over again. So the liver somehow knows that, and its function is to change solubility so the drug doesn't reabsorb over and over again, and ultimately it will get excreted. There's 4 ways the P450 is used to change the solubility and biotransform, and they're called oxidation, reduction, hydrolysis, and conjugation. These are the processes that liver P450 enzymes do to biotransform drugs, changing their solubility, and therefore increasing the elimination and excretion portion of the drug, a portion of the drug outside of the body. Here's some types of P450 enzyme really quickly. You can see that there's different types. There's actually more than this, but I wanted to show you that The liver has a lot of the CYP3A4. Now, this is one of the P450 enzymes, of which there are many. But this 3A4, this CYP3A4, you can see by the amount of proportion in the pie chart, it's huge. And that's because these P450 enzymes, these CYP3A4, they're really versatile in what types of things that they inactivate. Not just drugs and molecules and medicines, but airborne pollutants, food preservatives, and pesticides. And then excretion is largely a role of the kidneys, and they perform two major functions, metabolism and excretion. There's the two organs about the size of your fist, located on either side of the spine in the back. Most drugs, particularly water-soluble drugs and their metabolites, are eliminated largely by the kidneys via the urine. And then there's the concept of a drug half-life. And basically, half-life is an estimate of how long it takes for the amount of the drug to be reduced by exactly a half. For example, if 100 milligram of a drug with a half-life of 60 minutes is taken, the following is estimated. Drug is taken, 100 milligrams, 60 minutes later, 50 milligrams remains in the system. Without taking anything else, 60 minutes after that, which is a total of 120 minutes, then there's 25 milligram remaining, and so on and so forth. In theory, in this example, after about 300 minutes, almost 97% of the drug will have been eliminated. Most drugs are considered to have a negligible effect after 4 to 5 half-lives, unless more is taken. However, this doesn't mean it wouldn't be detectable. It would require a drug test. Steady state is when the amount of a drug being absorbed is the same amount that's being eliminated from the body when the drug is repeatedly taken. So it's the time during which the amount of the drug in the body stays constant. And for most drugs, the time to reach steady state is about 4 to 5 half-lives if the drug's given at regular intervals. And in medicine and medication-assisted treatment, the idea is to help the patient reach steady state so that the drug is doing what it's supposed to do. You don't want too little of a dose because it doesn't do enough, or if anything, and you don't want too much of a dose because of side effects and potential toxicity. So here's a summary, putting it all together, of pharmacokinetics. Administration is how a drug gets into the body. Absorption is how the drug gets from its site of administration into the blood. Distribution is how the drug moves from the blood to other parts of the body. Steady state is when the process of absorption is happening at exactly the same time or the rate of elimination. Metabolism is the biotransformation of a drug, mostly via the liver and the P450 enzymes that alter the drug's solubility. The half-life is the time it takes for about half of the drug, actually exactly half the drug, in the body to be reduced by 50%. And then finally, elimination and excretion is how the drug is removed from the body. Well, I hope this was helpful, this brief overview, and I'll see you next time.